Ear, nose, and throat specialists hear this all the time. I always breathe better when I'm on vacation, and I feel I'm hearing all the time.
Right.
My allergies are so bad. But that might not be the case.
May not be, yeah.
It's an unexplained stuffy nose. It's being called Alberta Nose. Is this a new thing, Leah?
It is a new thing, and it's coined by doctors here in Alberta because they're not seeing it anywhere else, really. So basically, there are many reasons children and adults can get a stuffy nose. So the two main causes in children, anyway, are an enlarged adenoid, and that's the tissue at the back of the nose that's too big, so that it's basically blocking airflow. And that's called rhinitis, and that's a fancy term, basically, for a stuffy nose. And as far as rhinitis goes, it can be allergic, which is caused by allergies, or it can be non-allergic. And there are lots of kinds of this type as well. But the one that's so very common in Calgary is the non-allergic rhinitis, or stuffy nose, that doctors really just can't explain. And it is a really fancy term, idiopathic non-allergic rhinitis. But of course, that's too long, so they have a more colloquial term, and that's Alberta Nose. And they've come up with this because it is so pervasive in Calgary. And basically what they're saying, I interviewed Dr. Warren Yunker from the Children's Hospital, and he says he sees about 5 patients a day with this type of Alberta Nose. When he practiced in Houston, for example, he basically saw none of it. And really, he's seeing so much of it here. So Dr. Yunker says doctors will hear, my child can breathe better when we go on vacation. But, you know, they were sort of figuring out it has nothing to do with really going where they're going on vacation. Because, you know, you hear it when they go to hot, humid places. You hear it when they go to hot, dry places. So it actually has to be more than that.
It's probably not one specific thing like humidity or altitude or dryness. We do wonder if maybe there's something coming off of the foothills, a particulate matter that is just very irritating to the nose that we don't know or can't identify. But again, we don't know for sure, but that's somewhat of the leading theory at the moment, is that maybe there's something coming off that we don't know about, because we can't just say humidity is the cause or altitude is the cause, because it seems to be more than that.
So it could be something coming off the foothills, but it could be many things at play. But the bottom line is that doctors don't really know what it is, but they do know that it's incredibly common here in Calgary. So then it becomes just a matter of treating those symptoms. And there are lots of options, but the question is how much are those symptoms actually bothering you? And of course, it's different when it comes to adults and children. But in children, you have to ask the parents, how much is it bothering you? So can the child sleep? Can the child eat with their mouth closed? Things like that. And if they're not sleeping, is it impacting their day-to-day life during the day? So these are the questions that you have to assess. And then what you'll basically do is come up with a treatment plan based on how bad the symptoms are for you. Or for adults, again, how much is it affecting your life? You know, is it affecting your sleep? Is it affecting your work? Is it affecting your school? Stuff like that. And then you come up with a treatment plan. But there is, of course, determining a course of action.
The mainstay of treatment really is the humidifier in the bedroom and the saline sprays in the nose. Try to avoid anything like an over-the-counter decongestant. Prolonged use of that can actually cause further problems. You actually become addicted to the nasal spray, and then when you try and stop it, things get considerably worse. So saltwater rinses are really the mainstay of treatment.
Yeah, so simple saline rinses are really, really simple. Now, not so simple, of course, when it comes to the children. They can be a little more challenging to get those nasal rinses up there, but it's worth giving it a try. But the bottom line is, if those two things are not working for you, the humidity in the bedroom or those simple saline rinses, if that's not working, then you can talk to your doctor about prescription nasal sprays. So these are going to be steroid nasal sprays, and they're supposed to be used over the long term. And I want to make this note to parents, because often parents will just shoot it up there when they're really problematic for the kids, but that's actually not the way these nasal sprays work. You want to use them over the long term. So you want to develop a course of action that goes long term, because in that case, what happens is it starts to downregulate the gene that's at play there. So that's what you want to do. And also when it comes to the kids specifically, you really want to get them into the routine. So, you know, I wash my face, I brush my teeth, I spray my nose. That's what you really want to establish with the kids.
Right.
Yeah, so then they get into the routine, and that's when it's going to really start to work for them. Bottom line is, though, if something is irritating the nose, you want to wash it out, right? So that's the bottom line. So if you can do it with your kids with these sprays, that's great. Adults really should be spraying their noses every day if they're getting some kind of irritation there.
Is that right?
Yeah.
Interesting.
Yeah.
Alberta Nose.
Alberta Nose.
Some of it's a mystery, some of it you can solve. More information on your blog?
Absolutely, on my blog.
Okay. Dave Will, do you suffer